I'm Mohamed Sadak. I'm the clinical lead and program manager for antimicrobial resistance and sepsis from Health Education England. And I'm here really to talk to you about the initiatives that we've undertaken at Health Education England and what's happening nationally around education and how we can be supporting yourselves at ground level in terms of implementing educational initiatives. Just to briefly take you through what we do as Health Education England, we were set up in 2013 and we really exist to support the delivery of excellent healthcare and health improvement to the patients and public of England by ensuring that the workforce of today and tomorrow has the right numbers of skills, values, behaviours at the right time and in the right place. And our operational governance really is mandated via the Department of Health, via the HE mandate. And I've got the 2015-2016 mandate here that gives you a brief outline of exactly how we go about doing what we do. So firstly, one of our objectives was to work with Public Health England in ensuring the competence and principles of antimicrobial prescribing was implemented within professional curricula and within health education institutions. We also have a remit to work with universities, commissioners and employers to ensure workforce capability and education and training. And lastly, we've also given a remit around sepsis education, so to ensure that the system was aware of what was needed and what was required in terms of sepsis education. So in terms of our work streams, I'm going to quickly go through these. The AMR work stream involved 4 different aspects. So we launched an introductory e-learning module that I'll take you through. We also did some work looking at competencies within higher education institutions. We launched an AMR Animation also, and this was largely around the work that was carried out by the Wellcome Trust last year, and we did this in conjunction with the Chief Medical Officer. And we also looked at the AMPS, which is the Antimicrobial Prescribing Stewardship Competences that Public Health England published in 2013 and how these were embedded in professional curricula. With regards to sepsis, we developed a film around pediatric sepsis that I'll take you through. There's also resources now available for primary care, so GPs, every professional working in primary care can access these resources. There's some work that we've done to look at what is available across the system, so what kind of educational interventions and initiatives exist within the whole system of primary and secondary care. There's some work going on with the RCGP around the GP Spotlight project, and we're also working closely with the UK Sepsis Trust. I'm sure Ron Daniels has probably already talked to you this morning around various initiatives. So, again, briefly going through what antimicrobial resistance is. I'm sure you've heard enough about what antibiotic resistance entails. The WHO has clearly set it out, clearly linked to overprescribing of antimicrobials, inappropriate use of antimicrobials, the overuse of antimicrobials, including both in human and animal welfare, poor infection control practices, lack of adequate hand hygiene and poor sanitation, and also the lack of new antimicrobials coming through the system. Ali has probably touched upon this, the Antibiotic Guardian campaign, I hope. So again, yes, if you haven't signed up, please do sign up and do encourage engagement within your organizations if you can. Taking through the future, again, you might have already seen this by Lord O'Neill and his work around the review of antimicrobial resistance. Clearly, the projections are quite frightening. 10 million deaths by 2050, more than cancer, and a total of 100 trillion cost implication to the worldwide global economy. So what's happening now? Well, again, you might have already seen the UK AMR high-level strategy, and that sets out key areas for action. So I'll just focus on where we come in, and that's number 3, which is improving professional education, training, and public engagement. So, in terms of what we've done, I hope you may have come across this. We launched this introductory e-learning module last year, just to coincide with the European Antibiotic Awareness Day. It's available for everyone across the whole system, be it whether you work in the NHS or the private sector. Ideally, if you work in the NHS, do log in if you can. That just gives us details about who's using it and how people are using it. If you do not work within the NHS, you can access it freely. So just go to the open access session on the left. You can see the tab there. And, do go through the e-learning module. Any feedback, my email address, I'm sure you've already had through the fact sheets that were distributed earlier. Please do get in touch. We really look forward to any feedback that you may have. It's available to everyone in health and social care. So regardless of whatever environment and sector you work in, please try and promote this as much as you can. It covers every bit of antimicrobial resistance and also IPC. So anything to do with infection prevention and control, hand washing, the risk of C. diff, MRSA, ESBLs, that's all included within this module. Of course, if there are any gaps, then please do get in touch. We will look at how we can adapt the learning module. But what we propose to do later on this year is to look at how this is being used within the system. So our trusts really utilizing this as a learning resource, how is it being embedded within organizations, and what can we as an organization do differently to ensure that we can engage with yourselves in the system also. In terms of the other work that we're looking at, we've scoped higher education institutions, so all universities in England, with regards to the implementation of the Public Health England antimicrobial prescribing and stewardship competences. Now, the report is about to be published. Hopefully, it should be in the system this week, but the report is available on our website. I shouldn't be telling you this until it's launched, but it should be coming out this week. But if you do want to read it, please do read it. We've made various recommendations to various organizations, including Health Education England, and there are also links to a variety of resources, so things like the Public Health England AMR Resource Handbook. We've linked to various education and training packages that are currently available in the system for use for all types of different health professionals. Clearly, looking at the data, there are certain gap areas that we need to focus on. Nursing and midwifery in terms of infection prevention and control, 85% and 86% compliance, that needs looking at. There's also other various areas that needs looking at throughout all the professional groups, including independent prescribers also. So that's the things that we wish to look at this year and in our future work plan. In terms of response rate, unfortunately, it was quite low. We had 45 universities respond with 100 different course responses. So that was around 50% of universities responding. But 86% confirmed that they're aware of the AMPS competences. And again, you'll be aware that this is now a requirement. So if you are a prescriber, you really need to be engaging with the antimicrobial prescribing and stewardship competences as part of your daily practice. There's also some work around GPs and AMR. Unfortunately, I don't think the links are working, so I can't show you the film. But again, it's on the fact sheet. But if you go on YouTube, you can easily search for this. And this was an initiative by the Chief Medical Officer in conjunction with various system leaders, including Professor Mike Charland, who heads the RHI, which is the Antimicrobial Resistance and Healthcare Associated Infection Group, chaired by the DH, and Clodagh McNulty, who is actively involved with the target work around primary care. So the main aim for this is really to raise awareness in primary care, for GPs to be aware. 70% of antimicrobials are prescribed in primary care. So that's really the big area that we need to really focus on. So if you do work in secondary care and you have links with primary care, do share this. If you work in primary care, do share it amongst your networks, use it as part of your presentations, just send it out through your newsletters that you send through via organizations. It's a 4-minute clip that really highlights what the issues are and what needs to be done in the system. The purpose of the initial film is to introduce people to the AMR Animation and the target resources. The AMR Animation was developed last year again in conjunction with Public Health England. And this came about from the Wellcome Trust's work that looked at public perception around antimicrobial resistance and what they felt antimicrobial resistance was all about. So it's a very short clip. Again, I wish I could have shown this to you. I don't think it works, but it's fine. Quite easy to access on YouTube. Just type in AMR Animation and it should come up. And really, the purpose of this is for health professionals to be able to share it with patients. So whenever you're confronted with a request for antimicrobials or you wish to educate someone around antimicrobial resistance, then it's a perfect animation just to distribute and share across your system to say, this is what the issue is and this is why we need to be all aware of it. So moving forward in terms of our deliverables for 2016-2017, we have 3 main aims really for this year. And the first one is to look at what education exists in the system with regards to training prescribers around antimicrobial resistance. So really what we're interested in is what your organizations are doing in terms of training prescribers and also non-prescribers if you have training packages already available. So we will be sending out the questionnaire later on this year. So if you do have any e-learning or in-house training packages that you're already using within your organizations, feel free to email me really what our purpose is to be able to share this across the NHS and share it with other organisations. So, if someone's developed something really good and we feel there may be a remit for us to be using it across the system, why not? So that's our first main aim and priority, is to really identify what exists out there for prescribers. The second bit is looking at how the introductory e-learning module that I've already taken you through has been embedded into the system. So really exploring how it's being used and what can we do differently to ensure people are using it. And the third bit is around looking at how we can be promoting areas of good practice. So especially from the scoping report that we've just undertaken in terms of identifying what exists out there in the system. Quite a few universities doing very good things around education and training of undergraduates with regards to antimicrobial resistance. So is an avenue we can be sharing all this information on one platform and distributing that across the organizations, be it in educational sectors or within the health sector itself also. So that's it for AMR. Just to take you briefly through sepsis and what we're doing around sepsis, the main national drivers around sepsis, and again, you might have already come across these key documents. Firstly, via NHS England, which is the Cross-System Sepsis Board, and the report that they published in December 2015 that really set out the agenda for sepsis across the system in England. And also the NCPOD report, Just Say Sepsis, that highlighted the deficiencies that exist within the system at the moment with regards to sepsis recognition and management. Now, key facts, briefly taking you through this, 37,000 deaths occur in the UK. Again, numbers vary. Some quote around 55 to 60,000 deaths a year. There's a 35% mortality risk with patients who develop sepsis. 1 in 3 ICU admissions are as a result of sepsis. 1 in 7 deaths in hospitals occur due to sepsis. And the cost to the NHS in England is around £2.5 billion a year. Unfortunately, 70% of these cases, again, develop in primary care. So 70% of antimicrobials is prescribed in primary care, 70% of cases of sepsis develop in primary care. So what are we doing? The first thing we looked at was pediatric sepsis. Quite high national profile deaths have occurred over the years with regards to sepsis. You have the Parliamentary Ombudsman's report, Time to Act from 2013, that covered this, into the death of Sam Morrish that happened around Devon. Most recently, you'll be aware of various other national cases. So what we did really was to look at how we could engage the system in raising awareness. And we did this with various people, Jason and Clara Watkins. Jason, you might recognize, is actually an actor in real life, but unfortunately he lost his daughter, Maud Watkins, to sepsis in 2011. We also had Dr. Nellie Ninnis, who's a consultant paediatrician at Imperial College London, help us with this, and Dr. Tim Fuchs, who's a GP and has worked quite widely with initiatives around managing sickness in children. So we've developed a film, and the idea of the film really is to give the viewers an idea of exactly what kind of things happen around sepsis and what they can do to help ensure that patients are captured quickly and are referred to appropriate services. And what we've also done is to signpost people to the relevant educational resources. So there's various other bits that we've referenced people to, including Spotting the Sick Child, which is a website developed by the DH, which has various educational resources around spotting the sick child or symptoms in sick children. There's also various initiatives via NHS England, including videos and teaching resources around how to identify sickness in children. So I would urge you to have a look at this if you haven't. And again, it's something that you can share within your organizations, and do encourage people to access the resources at the end. We will be measuring that again. How are people embedding and utilizing these resources that we're signposting to? The second piece of work was around primary care, and this was the biggest gap area that we found through an audit that was carried out by the RCGP, that there wasn't anything that existed in primary care. So we set out to develop something with the RCGP. Dr. Simon Stockley, who's now the RCGP's clinical sepsis lead, was the main author for this. And we've developed 5 sessions under the primary care sepsis resource. The first one covering an overview of sepsis, and really we've left the first module open for everyone to use. So regardless of what you may be, whether you're a nurse, a pharmacist, a paramedic, any clinical professional working in primary care can access the first one. The second, third, fourth, and fifth ones are adult sepsis, childhood sepsis, complex sepsis issues, and the care home and frail and elderly session. That's targeted towards GPs, but again, anyone can access them. So just because they are for GPs, if you feel, it's within your clinical competence to access them, then please feel free. Do use them as part of your learning, and again, promote them within your organizations and encourage others to partake in the learning also. We also undertook some scoping work. So we looked at what exists within the system at the moment. It was quite a wide-scale piece of work looking at all the acute hospitals in England. We also contacted various royal colleges. We spoke to the Academic Health Science Network. We spoke to our local offices to find out exactly what was happening. We got in touch with the ambulance trusts also to find out exactly what they had in terms of education and training. This report is, again, nearing completion at the moment. We're just waiting for it to be signed off by our exec board, so it should be made available in the next few weeks into the system. And again, what we've done within this report is to signpost people to relevant education resources that you could be using as part of your organizations or within any both primary and secondary care training and learning for staff. The other work that we've done with the UK Sepsis Trust, Ron Daniels, I'm not sure if he covered this. We've got this Sepsis Savvy micro-teaching session that's being developed at the moment by the UK Sepsis Trust, but there's also an innovative film that was developed by the Royal Surrey County Hospital in conjunction with the Health Foundation, the UK Sepsis Trust, and ourselves. This is available on our website, so again, just Google HEE sepsis awareness, and you should be able to access the film. The first bit of the film is more relevant towards primary care, so it's got a scenario of a GP who's confronted by a patient who's potentially got sepsis, and they have to work through various solutions to be able to diagnose sepsis in that patient. And the second scenario is around a healthcare assistant in secondary care and how they go about escalating or raising awareness within the system of a patient who may have sepsis and how to contact various clinical professionals within the organization. So please do have a look at it, and try and utilize them again within your organizations. The next bit of work we've done with the RCGP, as I said, we've appointed Simon Stockley as the clinical lead for sepsis with the RCGP. And really our plan is to develop a clinical toolkit for primary care, and that's currently being developed and should be launched in the next 2 weeks. And there's also going to be 4 regional workshops across England targeted towards staff in primary care, so practice nurses, receptionists, GPs. And really what we wish to do is to highlight what resources exist, again, within for learning and also within the system. So the HEE team, just to take you through who exactly we work with, we've got various directors who are SROs. Diane Ashiro-Doppe, unfortunately, is not here, who works for Public Health England. She worked with Health Education England, and we work quite closely with her with the developing AMR resources, and Ali also, so Ali has already spoken to you. And we also have support from various medical education fellows and various professionals within Health Education England. So thank you very much. I hope I wasn't too fast, but thank you for listening.